Hi there, this is Dr. Katrina Cox. I'm a naturopathic doctor and the leader of the Cancer Remission Mission. I'm back with you today to talk about colon cancer. Colon cancer is a really important cancer because it can show up in so many different ways. There are hereditary factors, which means that there are familial lines that are more susceptible to colon cancer, but there are also lifestyle factors like exposure to certain toxins and doing certain jobs and having certain pre-existing diagnoses, and sometimes it can show up out of the blue. Women and men are both capable of having colon cancer, and there are some basic screening things that we use for patients to find out if they have colon cancer. Everyone knows about the dreaded colonoscopy that they will do once every 5 years. They check out polyps and take them out. It's a cancer that I see quite a bit of in terms of recovery because there are a lot of stages for recovery after being diagnosed with colon cancer. So conventionally, the monitoring strategies are blood work. That's the simplest one, and that one can be done pretty regularly, like clockwork, every 3 to 6 months. The blood work markers that generally they follow, your oncologist will follow something called a CEA marker. It may have been done previous to your diagnosis or during your treatment plan, and most of the time it is followed throughout treatment, and it is a marker that shows us about tumor growth. That's its key component. Okay. And so depending on we depend on it to keep it in check, only certain amount of numbers lower than a certain amount in order to be able to, kind of guess at tumor growth inside the body. It's a general tool. Okay. That your conventional oncologist will use. It's a good tool, but there are more strategies that we like to employ naturopathically to round that strategy or that maintenance therapy out. Complementarily, we can look at other blood work, things like inflammatory markers, ESR, erythropoietic sedimentation rate, it's a mouthful, and CRP, C-reactive protein. Both of these numbers have been shown good in studies that if we can keep them down and lower than a certain point, that they can actually reduce the risk of reoccurrence. They also can show us if there is systemic inflammation in the body, which could be host for more cancer to grow. And so that's one of the reasons why we use them. They're not very specific, but they are, a good marker for generally for cancer and cancer recovery that we can watch. Another factor is a vitamin D level, for example, and there are other nutrients like B12 and iron. These are all markers that can help us understand what's happening from a nutrient perspective inside the body. Vitamin D is a special one because it also has been connected to reduce reoccurrence. If we can keep it in the top quarter of the blood work zone, then we can reduce our risk of reoccurrence, which is really great. Some of the other nutrients that we follow, like B12 and iron, have a lot to do with how symptoms can play or can lag us, like energy levels, ability to sleep, nutrient levels in terms of digesting our foods. So these are things that we do as well for our complementary strategies because they have a lot to do with how we function on a daily basis. This is a really big question, but there are a lot of things that we can look at to support you. One of the biggest pieces is, where are we at in that journey? Right? Are we waiting for a reversal? Are we still have an ileostomy bag, or are we getting prepped for that surgery to do that reversal? Are we also looking at post-reversal? How have things been since? And there's a whole level of steps. Some of them are pretty standard. Like, let's take a look at the foods that you digest the best. So I work with patients such as yourselves to figure out the 15 or 20 foods that do the best, and making sure that we're finding a variety of proteins that are easily digestible, easy to break down, that you're getting access to, looking at vegetables and fruits and what they would provide for us, which is those vitamins and minerals that we're looking for. And that's a caveat that can be very, very challenging to digest. And so how do we break that down and make it so that they're more easily digestible? And so that is something where we can consider how they're prepared, right? They are much more easily to digest if they're in soups, for example, or they're much more easily digested if they're baked, for example. So that can be a big component to where we can go with getting some of those things into us and being able to access the nutrients that they provide us. The third thing that we look at is, how do we make that tissue healthy? right? And so this is where we'll talk about different supplements. Things like probiotics can help to, rehabilitate that healthiness in those cells and in that area of the large intestine that's been affected by colon cancer. There are amino acids such as glutamine, for example, or herbs such as boswellia that can be really helpful in bringing down those inflammation markers that we were talking about before and really getting the tissue very healthy so that when we go through a reversal, or if we're post a reversal, or even if we're, after chemotherapy, that we can actually make it so that it's not such a raw place, and that we're actually able to slow the digestion down a little bit, or get more formed stools that are much easier to pass, that allow for us to know that we're getting the nutrition from the food that we're looking at. And so those are the 3 strategies that I work with patients on, is identifying the foods that do the best, in terms of digestion, making sure that they come from variety sources of proteins, minerals, vitamins, looking at ways to prepare them that equate easily to our body, and making sure we're filling any voids that we are missing. So things like finding fiber supplements that work for us, and those types of things. And then the third thing that we look for, or that I look for with patients with the situation that you're in, is looking at supplements and what are the things that really are connecting to where you're at in your strategy. Is it a probiotic that we need? Is it an amino acid that we need? Is it an herb that we're looking at to do some healing? And when is the timing to put those in? And how could that be beneficial for you? If you have any other questions, feel free to email us at hello@cancerremissionmission.com, or check out our website and the book to get more information for you.